is your exam tomorrow. This is your last minute prep for your OET discharge letter. If tomorrow on the exam this letter comes on your OET, you quickly jump on to the task and then you read that this is a discharge letter back to the patient's GP. Let's revise how we would plan this letter. Before planning any letter or before even going into the exam, you must have your game plan ready. So what I would advise that when you begin the exam, you've got about 5 minutes to prepare when you're not allowed to touch any stationery or write anything down. So during that time, you prepare and you plan out your task. You read the task thoroughly, you figure out who you are, who your patient is, at what point of your hospital admission is this patient at? Is this patient getting transferred? Are they getting discharged? Or you're just updating the GP about their changes? So also read as to who your audience is. Is this a letter back transferring a patient back to their GP or discharging them back to the GP? Or is this a referral? So in the 5 minutes you figure all of these things out. Now once you have your initial 3 minutes when you can start writing down, you underline the important points. Because this is a discharge letter, you need to figure out what new has happened during the course of this patient's hospital stay that you definitely need their carer to know about. You plan about 30 minutes to write, and the next few minutes I would advise that take at least 5 to 10 minutes, just revise your letter. Revise your letter for spelling mistakes, for punctuation errors or basic grammatical errors. Let's see what we would do on our OET. When I'm planning my task, I always decide what information needs to be included and what needs to be excluded. Because this is a discharge letter, my main point is that the person that I'm sending this patient back to is the regular carer for this patient. So telling the doctor or telling the nurse or telling the practice things about this patient's past medical history are going to be wasting their regular carer's time, and that's what basically the examiners are looking for in a discharge letter. So I decide that I will only include things which are new, which have happened during the hospital admission, things that we have changed in this patient's care, and the plan that we have for their discharge. Let's see, this is how I would underline my letter. I would underline only the things which are a part of the task. Sometimes they might throw you a curveball and they might include something which is a bit different from what has happened during this hospital stay. So in this task, they've actually asked us to mention pertinent social needs. So when I'm underlining, then I would underline all the social needs and everything new which has happened during the course of this admission. This patient was admitted with thyrotoxicosis and had a new diagnosis of atrial fibrillation. That's definitely very important to write to the GP about. I've also circled my task because I need to read the task at least 3 times, because marks for purpose are for me to follow my task and to mention the purpose of writing this letter extremely clearly. So I've circled that in red. On your exam, you can just circle it. Moving on, let's see how we would plan our paragraphs. My first part of my paragraph would be thanking this doctor for taking this patient back into their care. Because this is a discharge, I would mention the reason why they were admitted in the hospital. So that would be my hospital diagnosis. I would also make a special paragraph just for discharge planning. It is extremely important that the GP knows as to what plan has to be followed when this patient goes back to the home or goes back to the care of this GP. And then I would conclude the letter normally. let's revise our cheat sheet. My cheat sheet for purpose would be, thank you for seeing Miss June Fortune, comma, a 46-year-old lady. Please revise where we put the comma and the way that I've written 46-year-old lady. She is being discharged back into your esteemed cares. Because it's a discharge letter, you get discharged back into your esteemed care. Or I can use a variation. I can write, I am writing this letter to inform you regarding Miss Fortune's imminent discharge back into your esteemed care. Or we can just write, Miss Fortune is being discharged today back to your practice. Notice the tenses that we have used. Being discharged, I am writing. Let's not make that mistake in the exam tomorrow. My cheat sheet for new diagnosis. Because this patient was admitted to the hospital, they had a diagnosis of admission, so I'll write that down. Miss Fortune was admitted to our hospital with a new diagnosis of whatever their diagnosis was. She would benefit greatly from your continued care. Always thank your audience. Remember, you have marks on your OET for that. You can also write, Miss Fortune was admitted to our hospital with signs and symptoms of whatever disease they had, and if they had a new diagnosis, you write, she was also found to have new onset, whatever new diagnosis they had. My cheat sheet for the treatment that we gave this patient. Due to her new diagnosis, comma, she has been started on whatever medications you've started this patient on. She would need continuation of the same in the community. So remember the tenses that we've used. This is the future plan for a patient. So it's written as she would need continuation. Or we can also write, during the course of hospital admission, comma, Miss Fortune was started on, because the hospital admission was in the past. That's why we've written was started on. She has now been prescribed, because the patient will still remain on those medications when she's getting discharged. So it's she has now been prescribed dash along with advice on whatever regular lifestyle advice you want this patient to do. She would need monitoring of her compliance in the community, because it's in the future. So it's she would need monitoring. The conclusion is the same. Your continued care with regards to this pleasant lady would be highly appreciated. Please do not hesitate to contact me in case of any questions. So this was your quick revision of your OET discharge letter. Concentrate on the tenses. Remember, this letter is a discharge letter, so your content is going to be your hospital admission and the medications you've given this patient along with the discharge plan. So we're going to be concentrating on 3 tenses: the present tense when you're writing the letter, the past tense when you're describing the hospital admission, and the future tense when you're talking about this patient's discharged. If you do all of that, you will pass. Good luck.